Islamabad, you do understand that we are working towards universal health coverage by ensuring everybody in Punjab. Every family is going to be insured to the tune of 1 million rupees in Punjab. It's a huge contribution to people's health, where the government is roughly spending about 130 billion rupees every year on the premium which is going to be paid. And immaterial which class the person belongs to, every citizen of Punjab, every family head is going to get a card which is up to the tune of 10 lakh, 1 million rupees. And you can go and get these facilities from the empaneled hospitals which are from the private sector. Of course, the facilities which are in our hospitals are, some of them are free, but some of them have to be paid for, like in the cardiac units. And what we have ensured is that all our units in which you have to pay are all a part of that health card also. The record that I have is roughly about 500,000 people have utilized those cards, and we've had 96% satisfaction, so which is pretty good. And a lot of people who had to have their cardiac operations or their stents put in, the minute they got those cards, they went to these cardiac units and had their stents put in. So it's producing some good results, and hopefully keeping fingers crossed, we are signing our contract sometime on 15th of November, because it's the procurement has been done by the federal government and we are all working together on it. And by 31st of December we'll start the distribution of the rest of Punjab, working very closely with us in that. And I think one of the schools that we're doing is with the University of Fatma Medical College University, the other one is with Rawalpindi Medical College University. These services, even if we are, rather than investing on brick and mortar, I thought it was much better if we invested on the insurance, and in that way.
And by 31st of October, we would have finalized all recruitments, and the PMU should be up and running, functional by the 31st of November, when all the people are expected to join.
3 weeks. Because saturation has occurred. The areas where they were located, all the people over there who were willing to get vaccinated, they have already been vaccinated. And these were the people who needed vaccination for work purposes, for travel purposes, or they were literate enough to get vaccination. So now we have to get the masses out from their homes through outreach vaccine, so that those people who are somewhat hesitant or have not yet been vaccinated because of the distance from our mass vaccination center. So we are going to cover them.
Prime Minister Health Initiative District, and also some other selected districts for MNCH, DGHS 2 and quality of care. This is the sort of imaging which we have tried to done for various interventions in various districts of province, which you can see that we are working in quite many districts for different types of interventions.
So this is some of the work which is going on with the support of BNGF and CDC in some of the cities of Punjab. That's all from my end. Thank you very much.
Plan system for that we sit with member state at national level as well as at the provincial level. Under these 5 categories, that will be introduced in routine EPI. So the evidence produced was supported by WHO through these sentinel sites. We have the CRS surveillance sites, as well as we have typhoid surveillance sites, which are providing regularly data and all the equipment, training, supply.
The collaboration that we have been able to develop with the Department of Primary and Secondary Health is really exemplary. We have designed our interventions with the Department of Health, and we are implementing them with the support of Department of Health, and support them in diagnosing and treating TB patients according to the national guidelines, and then reporting that data to the national system. In Pakistan, overall, every year there is a large proportion of TB cases who are missed from the reporting.
Which is Evidence for Health. So this is a new program that we will be using in conjunction with the department starting next year, probably in April, and that is just going through improvements with ministers. It will focus again on health system strengthening, looking at improving health outcomes for the most vulnerable and supporting progress towards universal health coverage.
That is managed by Oxford Policy Management. The main aims of the project is to assist primary and secondary healthcare department in improving quality of and access to healthcare for people of Punjab. Cascade trainings to 4,817 end users.
We have a new family planning strategy at the global level, so I'll just say a few things about that. If this works, okay, it does. So our global new strategy for family planning, which took like 1 year because of COVID and everything to get. So it's going to be focusing on women and girls and about the informed choices, the new and better contraceptive options, which is responding to the needs of the women and girls and empower them to take the charge of their own health.
I'm not representing USA, I'm representing John Snow International, which is an implementing partner of USAID. But when COVID came, we extended our support to the entire country, and this includes.
We have been working at the highest policy levels to develop population policies, costed implementation plans for FP 2030, the very first adolescent and $1 million. And the first phase is now ending, and Pathfinder is looking to work with the government of Punjab to see.
And I extend my appreciation to you and to your whole team and to the team of the DG office who must have worked hard in arranging such an informative session for all of us today. This is going to be my first session as Special Secretary with the development partners here in the Health Department, although I have already worked in the Health Department way back in 2011 and 12. Always say that we have been able to achieve certain targets and we have been able to contain the calamity or the COVID-19 here in Punjab, as you have seen, the commitment, the dedication. Thank you for coming here and sharing all the work you people are doing in Punjab and in your own fields and different areas. This have been very informative and educative session. Successful and family planning services, which is very important.